Hey everyone, welcome to another episode of Ask Dr. J, and today we're going to talk about one of the questions I get quite frequently from parents, and that is, when should I bring my child to an orthodontist for a consultation, or when should my child consider having braces? So in short, the American Association of Orthodontics says that age 7 is when you should do this. And there's 3 possible outcomes that can come from this visitor consultation. Number 1, you go there and your child doesn't need any treatment at all at that time. Number 2, your child may need to be tracked for growth and development to see if something may occur that could be done to help future orthodontics if necessary. And number 3, there's an issue and you're right there ready to get it started that will vastly help your child's orthodontic treatment in the future. So why is age 7 a great time to have your child go see an orthodontist for a consultation? Well, at age 7, growth and development is still occurring, and it's an optimal time to identify any issues that may occur before the growth window closes. It's not that your child's going to stop growing after 7, but the window for interceptive treatment does close on some issues pretty rapidly. So what are some of these issues that would be in category 3 where you're going to have some type of first stage orthodontic or interceptive treatment? Well, the first thing that is most important is if the upper jaw is narrow or the palate is narrow, it's a time that you can use what's called a palatal expander and expand and stretch the jaw. The growth plate in the midline of the jaw is still open and growing, so it can be expanded and stretched much easier. And why is this important at this time? Because waiting too long until the growth plate closes will result in more costly and more invasive procedures where if you need to expand the upper jaw, it actually has to be a surgical procedure. So that's the first reason, palatal expansion. So another reason that you would do early interceptive orthodontic treatment is if there's severe crowding. You can do a first phase of this, which will make the second phase, when all the adult permanent teeth are in, much easier, less time, less money, easier process. Let's talk about some more. What's called a crossbite. That's when your upper jaw is inside your lower jaw. This needs to be corrected as soon as possible while growth and development is still occurring so that you're not having invasive surgical procedures, or if the procedure is not done, you may end up with worn teeth, damaged teeth, TMJ problems where your joint is uncomfortable as an adult. So by handling it early, you're avoiding a more invasive and costly procedure or the damages of not doing the procedure. And one final thing that I want to talk about that isn't talked about a whole bunch, not necessarily at age 7, but it's a time to start looking at it, is some of the social ramifications. So if your child is uncomfortable at school and maybe getting picked on because their teeth look funny or they're crowded, by doing phase 1 and just straightening up the front teeth, also preparing them for future orthodontics, which is a win-win, your child may feel better, more confident, and not have to avoid some of those social pressures. I've heard parents talk about their children feeling so much better after that phase 1. So please consider that as a factor for your child. To summarize, what's the takeaway that I really want you to hear? There's a narrow window of time that is closing for your child to get some of these interceptive or corrective measures that really, as the time goes by and the window closes, these interceptive procedures are off the table. What's that mean? That you're going to have to either do a more invasive or costly procedure to make some of these corrections, or they're not going to get done at all, and there's going to be other things that occur that negatively impact your child's health as they age. So really, please take this into consideration because it can have an enormous impact on your child in a positive way. Thank you for watching another episode of Ask Dr. J.